If you had a physical health condition like diabetes and we said to you, okay, well, the recommended treatment is this, but only 4% of people in the country will get it, there'll be an absolute outcry. But that was the position for people with anxiety and depression up until about 10 years ago.
Improving access to psychological therapies is a national programme that was introduced 5 or 6 years ago now as a way of recognising that there are lots of psychological therapies that work, but they were very poorly available.
Before the IAPT programme, we were not very good at recording the outcomes that people achieve in mental health services. Across the whole of the UK, less than 40% of people who were receiving psychological therapies for common mental health problems like anxiety and depression had their symptoms measured at pre and post treatment. It's now known that those people who tend not to give you post-treatment data tend to have done less well. So we were really deluding ourselves about how good our services were. The IAPT programme gets people to fill in a measure of their anxiety and depression every time they're seen. We now get pre and post-treatment outcome data on 97% of all of the people who have a course of therapy. This sort of level of data completeness in mental health has never happened in any other country.
It's been revolutionary. I think that we have demonstrated that a systematic approach to applying evidence-based treatments, routinely collecting outcome data, can make a massive difference to patients.
We've seen a huge change in the way that governments are supportive of the mental health agenda. I think this is down in large part due to what David Clark and Richard Layard have been able to do with successive governments.
Early in my life, I thought, you could just focus on the research, develop the treatments, and then people would read about them and say, oh yes, we're going to automatically deliver them to the public. But as time went on, I realized that this was almost a delusional belief. It simply isn't going to happen. And so you have to get active and try and do it yourself.
And just hearing how many thousands of people have got better. I think it's over 25,000 people now that have come in through our services in the last 5 years across Oxfordshire. It's enormously rewarding.